My name is Candace Burnett. I'm a pain management specialist, and I practice in Sugarland, Texas. So diabetic peripheral neuropathy, or DPN, is a nerve injury syndrome that can affect patients with diabetes. High blood sugar levels can cause injury to various nerves in the body. With diabetic peripheral neuropathy, those nerves most commonly affected are the ones in the feet and the legs. So some common symptoms are numbness or abnormal sensations in the feet and legs, and it can progress to severe and debilitating pain that feels like sharp, stabbing pain that often interferes with patients' ability to perform their activities of daily living. So it's actually a lot more common than we think. There are millions of patients living with diabetes, and about 25% of those patients will develop diabetic peripheral neuropathy. If you dive deeper into those numbers, over half of the patients who do develop diabetic peripheral neuropathy will actually have pain that persists even after trying some of the usual common treatments for the syndrome. So the pain would persist after treatment for multiple reasons. One is the medications can cause side effects that the patient can't really tolerate or side effects that they don't like, so they discontinue the medications. Another reason is some medications don't work for every patient with diabetic peripheral neuropathy. And another reason would be if a patient has other medical issues that make some of the common treatments and medications we use not an ideal treatment option. So there are several different medications and medication patches that are used to treat diabetic peripheral neuropathy. These medications include antidepressants, anti-seizure medications, and also topical medications delivered in patch or cream form. And so the reason they might not be effective is because of side effects that the patient cannot tolerate, or because they just aren't effective and don't adequately treat the diabetic peripheral neuropathy pain. Or there are instances where patients do benefit from these medications initially, but over time they fail to continue to provide pain relief. So there are a lot of side effects that can occur with these medications, and they can range from dry mouth or constipation or excessive sleepiness or mental fogginess. They can even cause liver or kidney damage or affect other organ systems as well. Spinal cord stimulation is a minimally invasive treatment option that sends out impulses to the spinal cord that block pain signals going to the brain. And that's how it helps patients with chronic pain, especially chronic nerve pain, as with diabetic peripheral neuropathy. Yes, there's actually very good literature and research that's ongoing. There are two robust studies in Europe and a study here that compare the effectiveness of conventional treatment for DPN to spinal cord stimulation treatment for DPN. And the results are pretty astounding. In the patients who are receiving spinal cord stimulation as their treatment therapy for DPN, over 75% of those patients achieved a reduction of 50% or more in their pain levels. So those are pretty impressive numbers. So just as important as lowering a pain level is what we can do when we're not in pain. So we look at a patient's functional improvements, such as being able to do their daily activities without pain, being able to sleep comfortably without pain, and participate in activities with their families, etc. And then also what's important about being able to adequately treat these patients is that it can lead to a reduction in the amount of pain medications they're taking. And that's important because all pain medications have risks associated with them and aren't ideal to be on for long periods of time. Yes, so the typical process for evaluating and selecting a patient for spinal cord stimulation is really to get the patient in front of a specialist who is well versed in the therapy and who is well trained in performing the procedures. And a lot of times that will be a referral from a primary care specialist for patients who just have not had success with the usual treatment options. So it's so important to spread awareness about spinal cord stimulation for treatment of diabetic peripheral neuropathy, not only to patients, but also to other providers. So they know that there is this treatment option for their patients should other treatments not work. Some factors that would make a patient ineligible for spinal cord stimulation for DPN would be if they have very poorly controlled diabetes that's not being well monitored or well treated as far as their blood sugar levels, because these patients are at an added risk for perioperative complications, such as infections and other complications. So, other instances where a patient might not be eligible for the device if they have comorbidities such as cardiovascular disease or severe pulmonary issues that make the procedure more risky for those patients. One of the best things about considering spinal cord stimulation as a therapy option for patients with DPN is that there's a trial period. It's one of the few therapies that a patient can try out first before they're committed to it. So during the trial, 2 wires are inserted into the spinal canal and they send out signals that block the pain signals from going to the brain. The patient has these temporary wires or leads in place for about 5 to 7 days. So they get to experience the therapy, see if they like the way it feels, see if it reduces their pain, if they're more active, and also if they need less pain medications. There's typically a short recovery period after implantation of a spinal cord stimulator. One of the things that's key to keep in mind, though, is that we don't want the patient to do any excessive twisting, bending, jumping, or other activities that could cause the leads to shift out of the ideal place that's providing them good pain relief. And so those restrictions are in place for about 6 weeks because at that time, the scar tissue has formed around the leads and they're nice and snug in place at that point. So diabetic peripheral neuropathy is one of the newest indications for spinal cord stimulation. So while many insurance companies do cover the procedure, it will vary widely based on your geographical location. So for that reason, I suggest reaching out to a local Medtronic representative who can help you with answers regarding insurance coverage. So I've found that in treating patients with diabetic peripheral neuropathy with spinal cord stimulation, I'm reaching out to a lot of different specialists that I might not have for other patients in my practice. So this includes podiatrists, neurologists, and other specialists who commonly see patients with diabetes. And it's great to have this collaborative effort with them because they might not be aware that there's even this therapy to offer their patients. I think in general, this has opened up the door for so many different opportunities to learn more about DPN and how to treat it. And I think with the advancements in technology that we have, such as spinal cord stimulation, and even the advancements in spinal cord stimulation therapy, we're going to see a lot of other options to offer our patients in the future. Medtronic collaborates with the medical community to enhance treatment options by putting on several outreach programs to provide information to providers, ancillary staff of all different specialties, and really just focusing on spreading awareness of the therapy and how well it can help those patients suffering in pain. Medtronic's spinal cord stimulation platform is very comprehensive and it offers robust technology to help treat patients with spinal cord stimulation. So they offer a rechargeable device that is the smallest on the market, and it has a proprietary lithium-ion battery chemistry that allows it to retain about 95% of its battery life at 9 years. So that's pretty incredible. They also offer a recharge-free device. That device might be used in patients who aren't very familiar with technology or comfortable with it, or in elderly patients or patients with cognitive difficulties, or just patients who simply don't want to recharge their device. And Medtronic's non-rechargeable device lasts 2 times longer than competitive devices when they're set at similar parameters. One of the great things about Medtronic as a company is they offer many resources for the patient. So there are patient educational brochures and pamphlets. There are what are called patient ambassadors. So patients who have had success with the treatment, who can talk to patients about their experiences. There's also an app on their device called Care Guide Pro, which allows the patient to have all this information at their fingertips. And they can also document how they're doing with the stimulation and how it's improving their daily lives. I think this is such an important topic because there are so many patients who suffer with chronic pain due to diabetic peripheral neuropathy. And when I see these patients, a lot of times what I'm hearing is they just want to do what a lot of us, I think, take for granted. They want to do their household chores. They want to go to work. They want to be able to sleep at night without pain. They want to play with their grandchildren or do things with their family. And I honestly don't think that's a lot to ask. And it's just very gratifying and rewarding to now have a system and a therapy that can help so many of those patients.